Ontario's healthcare system is facing immense challenges at this time. Hospitals continue to deal with capacity issues, with growing healthcare needs from our community.
Ontario's healthcare system has faced a variety of challenges over the last few years. Predominantly, health human resources is a very large challenge. We have a shortage of nurses, a shortage of doctors, a shortage of allied health professionals, respiratory therapists. Having them work at the Chatham-Kent Health Alliance is also a challenge because we are not necessarily the biggest hospital in Canada or in Ontario. We have a rural catchment area, and many people want to work and live in the city.
Healthcare philanthropy is becoming more complex, more competitive, and increasingly essential to hospitals. The foundation links the community of Chatham-Kent with the hospital by raising money through philanthropic initiatives.
Philanthropic investment from foundations is not just helpful, it is essential. It is about combining philanthropic vision, public sector mandate, and private sector capital to unlock new sources of sustainable funding, build income-generating ventures, and create long-term systemic change. Change that we are looking to implement this year revolving around innovative models such as prescribing transitional housing for our vulnerable populations.
My name is Kane Sooney, and I'm the Vice President of Clinical Operations. In order to support the healthcare needs of our community, the hospital has created a new strategic plan that outlines the key objectives and the operational realities anticipated over the next 5 years. Key focus areas include delivering safe and high-quality care, responding to population health needs, being an exceptional place to work. Key objectives will help us navigate the best care pathway possible to support population aging, increasing service complexity, workforce challenges, and constrained public funding.
A central message for the hospital was that philanthropy is no longer supplemental, but fundamental to the hospital's ability to maintain services and plan for the future. The hospital is a major piece of the fabric of our community. Predominantly, most of the people that work here are members of our close-knit community. They serve our community, they serve themselves, they serve their neighbors, they serve their family members.
If you are working in the healthcare system, and whether you've been here for 10 or 15 years or even 2 years, you'll have noticed quite a bit of change. One of the big challenges, if we're talking about our region in particular, is how chronically ill people are. It is higher than other regions in Ontario, which is an increased instances of mental health needs, higher substance abuse in the community, as well as a lot of socio-demographic factors that impact those things. This includes homelessness, this includes unemployment. We want to work with our partners to make the community healthier. That includes areas where we can help individuals who are of advanced age. Our population is aging. Those are needs that are going to be focused on, as I said before, higher chronic disease. There are needs in the community of increasing needs for children with mental health and addictions issues, and it's not just drugs and alcohol. There are increasing needs that are related to women and their children locally in the community. We have a high rate of complex births.
This really has allowed the foundation to evaluate what we do best. As philanthropic engineers, we're tasked to be creative and innovative, to really think outside of the box. What we've come up with is doing enterprises that require both the public and the private sector to come together. They meet philanthropy, and then we have wonderful ideas of how we can raise funds. A great example of this would be for the foundation to build a parking garage. And the revenue that we receive from the parking garage goes right back into the hospital to help with the programs and services.
I feel privileged to be here to work with a team that comes to work every day dedicated to taking care of their community.
This is why we are building capacity. This is why we are building equity.
We need to start thinking bigger, which is exactly what we are doing.